Do you ever just get those weird symptoms like itchy ears, or maybe you've noticed your odor has changed, your armpits smell like onions or muskiness, and you're not really sure what's going on and or how to address them, and you don't want to do hormones? I know. So here are 7 tips for 7 symptoms that seem to come out of nowhere. They're really annoying. They're hormone based, but it doesn't mean you have to be on hormones, and you probably have the treatment at home, or it's pretty easy to get at a pharmacy. So here are the symptoms we're going to talk about. Number 1, have you noticed your body odor has changed? Do your armpits smell like onions? Do you find like you're sort of sweating more, but not in like the hot flash way, but just like you're sweating a little more, you're a little more musky, a little more like deodorant use, feeling like you need to shower? We're going to talk about that. Do you feel puffy? Do you feel like your skin is puffy, your belly's puffy, your face is puffy? Everything's just kind of puffy, like water retention puffy? We'll talk about that. What about itchy ears? Itchy ears that come and go now that you are hitting perimenopause. What about sore, tender breasts? Yes, it could be from estrogen, but what if it's not? And how do we address that? Then, what about hair loss? I've talked a lot about hair loss, and I'm going to continue to talk about hair loss. But I've got a little tip that might be helpful is number 6. And then number 7, you don't want to miss, that is rosacea. But you may not realize you have rosacea. You may just have what you think are a little bit of red bumpiness on your cheeks. Maybe your nose is a little flaky, a little dry. I know because I went through it myself. And something that maybe you can talk to your dermatologist about. All right, let's back up. Number 1, your odor has changed. I hear this all the time from women. One of the common reasons is the shift in hormones between testosterone and estrogen. Because women it's perceived by the body that you have more testosterone, that's an androgen. So the androgen receptors are more affected, and therefore women can feel they smell a little more musky or a little more oniony, which I know is totally weird. But you're applying deodorant and you're like, no, it still happens. So here's one of the things that can happen at a pharmacy. Online, you can talk to your doctor. You can buy something called Hibiclens, which Hibiclens is actually chlorhexidine, and it's an antiseptic that you can get over the counter. And in the shower, you can scrub your armpits really well with a little bit of chlorhexidine. It's generally pretty safe. Now, people will argue with me that's going to impact the microbiome of your armpits. Well, guess what? Your microbiome is already impacted. It's already being androgen dominant in between lymph nodes, which we'll talk about next, and the microbiome. You're getting this musky, oniony smell. So in the shower, using chlorhexidine in the armpits. And when I mean scrub, I mean like definitely give it a good 15 to 20-second scrub at a minimum. Like really scrub that microbiome up there. Then shower like normal, right? Use your soap, use your body wash, use whatever you use. Once you get out of the shower, then you can use witch hazel. So applying a little bit of witch hazel, and you can get the alcohol-free, scent-free witch hazel on a little round circular cotton pad and swipe in your armpits. So do one side of the cotton pad, swipe your armpits, flip it over, or get a new cotton pad, witch hazel on it, and swipe in the armpits. If you are noticing like you're feeling kind of sweaty, a little musky, a little oniony down there, don't use the witch hazel directly down there on the lips. Nope. But on the sides, like where maybe your underwear, the elastic hits. So where the leg hit, like the upper leg sort of hits your torso, that divide in there. So swipe up the left side, swipe up the right side, get that witch hazel in there, and then let it dry. I know it sounds crazy, and it's not forever. It is not forever. This musky, oniony sort of change in body odor smell can come and go, and be, of course, be very hormone related. So when you're having it, have that chlorhexidine ready. Scrub your armpits in the shower. Use the witch hazel in the armpits and on the sides of the inner leg, inner thigh area. Let it dry, and that can really help shift that microbiome, get rid of the, like that bad odor, and then, do like normal. Then use your lotion, use your deodorant, et cetera, et cetera. Number 2, maybe you are thinking, Carrie, in the first one, you talked about lymph nodes, and maybe it's my lymph nodes are congested. Maybe congested lymph nodes means your face is congested. You're just feeling kind of puffy. Your rings are kind of tight. You just are feeling like you're holding more water than recently, and hormones can do that. Obviously, diet can do that. Stress can do that. Travel can do that. But if you're just feeling like puffy, just a little bit like a wet, like a sponge, and you've just sucked up all this water. Couple of things. One, it's going to sound counterintuitive. Make sure you increase your water and increase your electrolytes, but you don't want like a heavy sodium, heavy sugar electrolyte. Make sure that one that has actual sodium, but with like a decent amount of potassium as well. The second thing that I love to do, I learned from Dr. Caitlin, my friend Dr. Caitlin. She calls it the specific 7. It is a very quick, you do on yourself lymphatic massage. It doesn't take more than a couple of minutes. I do it in the morning, sometimes in the middle of the day for part of my body, and I'll do it at night before bed, depending on how I'm feeling. And it's a routine in a specific order that you just push massage, and you're just redirecting the lymph, opening up the lymph nodes and getting that fluid, that lymph fluid, because you have a lot of it, to drain in an appropriate manner. And just by doing that alone, the amount of feedback, the amount of positive feedback I've heard from women who are like, oh my gosh, my rings felt better afterwards, or oh my gosh, I feel like I urinated a ton afterwards, or my face got less puffy. My I could see my ankles again after doing a round of this for a couple of minutes. Huge. The other helpful thing at the end of the day is do the specific 7. You can look it up online. I'm not gatekeeping. You just have to type in specific 7 lymph massage and Dr. Caitlin will come up. It's very quick. But the other thing you can do is do the specific 7 and then lay on the ground or lay on your bed with your feet up against the wall. Even turn around on your couch and lay with your feet up while laying on your couch. And that feet up will help the lymph drain down, but you've already done the specific 7 to get it to move in the correct order and get all those lymph nodes open. Now, I think this is important because, I have heard so much feedback from women who go, God, I was so puffy. I couldn't figure out why I was so puffy. This was really actually quite helpful. It just took a couple minutes. I could do it myself and easy peasy lemon squeezy. Do you have to do it every day? You surely don't. But the days you're feeling kind of like the Stay Puft Marshmallow Man, then go ahead and do it. Number 3, itchy ears. Oh my gosh. Itchy ears was an early perimenopausal symptom for me. I still get itchy ears that come and go. So here are the 3 things that I use when I get itchy ears. I do use a Q-tip, so just be aware. I know not everybody loves Q-tips, but I'm not asking you to like shove your Q-tip in there and hurt your eardrum. We're going to be smart about this. One option, if you're also feeling kind of histamine, allergy-ish, if you have an antihistamine nasal spray, if you're already using it, you're already using an antihistamine nasal spray, spray some of the spray on the end of a Q-tip and swipe the inside of your ear. Because it's definitely possible the shift in hormones, especially estrogen, as estrogen swings up wildly, which can happen in perimenopause, that it slows the breakdown of histamine in the body. It makes your mast cells release more histamine, and then your symptom could be itchy ears along with everything else. If you're just feeling like, no, that's not it, they're just kind of like dry and crunchy in there and kind of itchy, castor oil or even a vitamin E oil, so you can puncture a vitamin E capsule, or if you happen to have like vitamin E oil you use on your body. If you happen to have castor oil, just a little, swap of the Q-tip in it, put it in your ear, swab it around to help moisturize it, help get rid of the crunchies that are in there, and very soothing and anti-inflammatory. If you happen to have estrogen gel or cream, whether it's vaginal gel or cream or systemic topical gel or cream, using a tiny bit on the end of a Q-tip and again, swabbing around inside the ear canal helps saturate the estrogen receptors in there. And for some women, that works amazingly well because the drop in estrogen dries everything out, including the inside canal of their ear. So the castor oil or vitamin E can be really nice because it's soothing and relaxing, and it's a pretty dry area. But then if you happen to have estrogen gel, cream, or even vaginal gel or cream, then a little bit of that inside the ear can make a big difference. All right, number 4, speaking of estrogen, this is probably the one time where I'd say having estrogen, of course, is going to be necessary. A lot of women, when they have dryness down there, when they notice like irritation, pain with sex down there, they will use estrogen that goes up inside. So they will use like a suppository that goes up inside. But yet they're also experiencing symptoms on the outside. Their labia is dry or itchy or shrinking. It's called atrophy. They're noticing their fun button. I can't always say all the words because I don't want to get banned and I don't want the bots to like come through and be like, no, like she said the wrong word. But the fun button can shrink down there. So a little bit of estrogen down in the sensitive area, but everything's on the outside, right? Where your urethra is, which is where the urine comes out, That whole area around there is called the introitus. So it's not up inside, but it's not fully outside. It's that like in between gateway that gets missed. So if you're just using a hard suppository or a beeswax suppository that goes up inside, you've missed everything on the outside lips, the fun button, that area with the urethra. So you may want to talk to your practitioner and say, I love the suppository, but I would also like to have low dose vaginal estrogen that I can apply externally as well. Or let's say you have low dose vaginal estrogen that's a cream or a gel, and you use it in an applicator. Just take a finger swab of it and rub it all the way around the outside from, all over. Catch the lips, catch the top, catch just inside the inside, and then use the applicator up inside. Talk to your doctor about it. Thankfully, this is getting a lot more education, but this is how I've been coaching women for 2 decades at this point, when they would say, I'm dry inside, but I'm also dry outside. Or I'm dry inside, but I'm also noticing like things are looking weird on the outside. Like it looks like it's shrinking or even changing color. I'm like, oh my gosh, we've already got the estrogen up inside. Like let's apply it on the outside as well. Number 5, sore, tender breasts. Now, this could be due to a change in estrogen, the addition of estrogen, not enough progesterone. For sure, tender fibrocystic breasts, hormonally related. But here's the quick tip that it could be also too much chocolate, coffee, tea, caffeine. There's another ingredient in those products called theobromine or theophylline, and they can, for some women, irritate their fibrocystic breasts. You will see mixed information in the research where people were like, no, caffeine doesn't cause that, or no, that's not how it works. But then anecdotally, you get feedback from women who were like, yeah, I cut back from 4 cups of coffee a day to 1, or I cut my chocolate habit way down, and I noticed a huge improvement. So if this is you are having tenderness, fullness, probably been told it's fibrocystic breasts. In some women, it is very reactive to caffeine or the other 2 ingredients, theophylline or theobromine. So that just means cut it out. I know, don't hurt the messenger, or cut it back. Other helpful things that I have found anecdotal, other than playing with your hormones, talk to your practitioner about your hormones, but I have found improvement in some women who increase their minerals. So when they increase things like their calcium, their magnesium, their potassium, they have found better saltwater balance and therefore don't feel as full and it's not as tender. I have seen women include vitamin E, natural vitamin E as a capsule, not topically, not like a skin cream, but like a vitamin E gel that they take that's a natural vitamin E. And I have gotten feedback from women that go, I don't know if it's placebo, but that really helped, especially leading up to my period. I've also had women use evening primrose oil. They'll get quality evening primrose oil. I've gotten feedback that has helped. Sometimes you'll see some sort of combination that has all of them together. And again, going back to the lymphatic massage, in her Dr. Caitlin's specific 7, she goes in and around the chest tissue. So she's on the side of the armpit, and then up in the armpit is those are 2 points of the specific 7. So it's also possible there's a lot of just chest armpit congestion. And when you start to move those lymphatics, like move sludgy, stuck lymphatics, that the water retention follows it. It drains appropriately. So again, breast tenderness is a big common one, not only with PMS, but also for women who are on estrogen, starting estrogen, changing their estrogen dose, or just in general. And then they're like, I don't know what to do. Like, it must be this estrogen I'm on. And it could be, but maybe it's not. So there's some options. Number 6, hair loss and castor oil. Okay, let's talk about castor oil. There's a lot about castor oil. I have been using castor oil since 1999. So I feel like, at least as far as do I have my castor oil street cred credentials, I do. Castor oil is thick and goopy. I am very aware. So for hair loss purposes, you have a couple issues that I have found maybe if you're going through hair loss that can be helpful. One is if you happen to do a hair mask, that you can include some castor oil in there. Now, castor oil is an oil, so you want to make sure it's organic. You want to make sure that it's in a glass bottle. You want to make sure it's hexane free. Don't just go online and buy any old willy-nilly castor oil that's in a plastic bottle, because that's just going to leach the plastic right into it, right? That's what oils do. So you want to make sure it's at least in the glass bottle. Try to get that organic. So you can mix a little bit of castor oil into a hair mask if you're doing a hair mask and apply it all over your head. Let it sit. Topically, I have found castor oil to be pretty anti-inflammatory. And for hair growth purposes, if your scalp's inflamed, the hair follicle is inflamed and mad, then it's not going to grow hair. So if we can calm that down as part of your hair mask and castor oil, that's fantastic. Some people do a pure castor oil hair mask. They will just apply castor oil in the places they're losing hair. So if you're losing it at the temples, I see women were like, get some castor oil and like massage into the temples. If they're losing it from the back of their head, the top of their head, they will just massage the castor oil there. They'll kind of put their hair in a loose bun, let it soak in for a couple of hours, and then wash it out. I will warn you, and I said it, castor oil is a thick, goopy oil. So you're going to, if you've never done it before, if you've never used it before, you're going to find that you're going to have to shampoo, wash, rinse, repeat a few times. Be gentle to get the castor oil fully out. The other alternative that I've also found to be quite helpful is just to put a few drops. Just a few drops of castor oil in your shampoo or conditioner. That way you're only getting like 3 to 5 drops. Just pour a smidgen, shampoo your hair, wash it out. Pour a smidgen in your conditioner, condition your hair, let it sit while you wash the rest of your body. Maybe you wash with the chlorhexidine, then you wash with your soap or your body wash. Let it sit there for a minute or two, and then you wash the conditioner out or whatever you do. I have found that women seem to like that also because it's just a few drops. It's more manageable as opposed to putting a goopy amount as a full hair mask or in the places that they tend to have thinning, like at the temples of their head. But in general, over time, I have seen lots of feedback that castor oil seems to work really well. One of the additions you can do, of course, is rosemary oil. You probably see rosemary oil all over for hair loss, and you want it in a carrier oil. And castor oil combined with the rosemary oil is like great. For a lot of women, not all women, but for a lot of women, that combination can work really, really well. So if you're already incorporating a rosemary oil for your hair loss, then the castor oil on top of it can help really drive it in and be anti-inflammatory. Number 7, let's talk about rosacea. The changes in estrogen can change your skin on your face. Maybe you had rosacea when you were younger. Maybe you had rosacea when you were pregnant. Maybe you're thinking, I never had rosacea. But yet you get these sort of pinkish reddish patches on your cheeks or on your nose, or you think it looks a little bumpy, like maybe you're going to break out, or maybe it's trying to form pimples and maybe then it goes away. Here's my personal story. I would have never said I had rosacea. I don't have the classic when you Google rosacea picture. I don't have that. But I happened to see my dermatologist recently because I see her twice a year. And she goes, what's with your nose? And I said, well, it's that time of year in the fall. It gets very flaky. And she goes, it's rosacea. And I was like, no, it's the fall. It's dry. It's like dry leaves. I have dry skin and they flake off. She's like, no, Carrie, I bet it's rosacea. She goes, do you ever get like a little bit of red patch or a little bit of what looks like maybe pimples are developing, but they're not just on your cheeks? And I was like, yeah, I do sometimes get that. She said, girl, it's rosacea. It's not as overt as some people's rosacea, but this is what happens when women hit perimenopause. If they have sensitive skin like me, I am a very sensitive bunny with my poor skin. So this is something that you have to ask a dermatologist or get compounded. But I want to put it out there. My dermatologist just handed it to me. She's like, we get compounded a triple cream and it works phenomenally well. It's a combination of azelaic acid, metronidazole, and the third ingredient, I don't actually know if I can say without getting banned for some reason. It was a really popular treatment in the pandemic. You can just Google IVER and then the whole word will show up. But it is an actual treatment for rosacea. So even though I'm talking about rosacea, and it's been shown that treatment that starts with an I, sometimes when you say it out loud in platforms like this, you get thrown in the doghouse and sometimes banned. So I don't want to do that. But it's azelaic acid, metronidazole, and that IVER, and then there's a whole rest of the word, but it'll pop up as soon as you type those words in. Combination, that's the triple cream that she uses, my dermatologist uses, has compounded for rosacea. And in fact, a lot of pharmacies compound that for rosacea. Girl, let me tell you this. I came home that night and I put it on my nose, my flaky nose, and the next morning it was gone. Yeah, it worked that fast. 2 nights ago, I started to, and I don't use it every night. I'm a spot treater. I don't need it every night. That's not how my newfound rosacea works. 2 nights ago, I look in the mirror after cleaning my face and I noticed on my cheek that I was having one of those patches that looked like maybe pimples were starting to form. Applied the cream. The next morning, it was all gone, back to normal skin. That's how fast it works. Now, could I do it every day as prevention? I could, but I don't tend to get these symptoms, like they tend to go weeks at a time as opposed to every day or days at a time. So I'm like, let's save the cream for when I need it. Every couple of weeks, my skin will get flaky or this red patch will show up. So that's how I use it. Your rosacea may be different if you're thinking this resonates with you, but I wanted to point out that triple cream works really well. And of course, I know that it's very hormonally related, but when your hormones are on a roller coaster, when you're, this age in life, it's what we do. It's what we got. That's what we're working with. So there you go. My 7 tips. Most of it you probably have at home. Some you may have to get at a pharmacy. 1 or 2 you may have to ask your doctor about. But I find that people are experiencing these. I see them in the comments and the DMs all over social media. They don't know what to do. They don't know how to help them. They're just suffering. I don't want you to suffer. And this is what I have found to be quite helpful. A lot of my colleagues and friends, and obviously in crowdsourcing from the comments, you are finding them helpful as well. So I don't gatekeep. I'm sharing the love. Why? Because hormones are like herding cats and we have to wrangle them as much as we can. And if we can use these at home, mostly remedies to help, then I got you.